The practical that I'm going to discuss today is measuring the blood pressure. So the object is to measure the blood pressure of a human subject by auscultatory method. The objective that would be covered in today's practical would be, I'll be defining the pulse pressure and the mean arterial pressure. You people should be able to describe the phases of Korotkoff sounds and the reason of their production, explain oscillatory gap, and define hypertension. The requirements for this practical are you need a human subject, a chair or a stool on which the person is going to sit, sphygmomanometer, and stethoscope. Sphygmomanometer is basically an instrument for measuring the blood pressure. This consists of an inflatable rubber cuff which is connected to a column of mercury. You can see that this is the cuff, this is the inflatable, and this is attached to a column of mercury, and this column is graduated. There are readings, markings or graduations next to this column of mercury, and this is helpful in noting down the reading of the systolic and the diastolic pressures. On the other side is this hand bulb. Okay, you can see that this is through a rubber tubing. This is also attached to the rubber cuff, and this hand bulb is used to inflate this cuff. This is the bulb which is used to inflate the cuff, and this valve is attached to this bulb, which can be turned clockwise or counterclockwise. For locking the valve, this needs to be turned clockwise, and when this valve is locked, even if you're going to pump through the bulb, there will be no inflation. So once it's open, by turning it counterclockwise, then you have to inflate the rubber cuff, and then you lock it by turning it counterclockwise, and then slowly the air or the pressure is released. So this sphygmomanometer enables the determination of the systolic pressure and the diastolic pressure by increasing and releasing the pressure in the cuff with the help of this hand bulb. There are various types of sphygmomanometer. The simplest type is a mercury column sphygmomanometer, in which there is a column of mercury which is graduated. The other type is aneroid, in which instead of a column of mercury there is a dial, and there are graduations on this dial which help in determination of the blood pressure. And in more sophisticated systems, you can also see nowadays digital sphygmanometers, in which the reading can be determined automatically with the help of this digital sphygmomanometers. Stethoscope is an acoustic medical device which is used for auscultation or listening to the internal sounds of a human body. The various parts of stethoscope are the earpieces. These earpieces are inserted into your ears, and these earpieces are, with the help of this metal piece, they are attached to this rubber tube, and at the end of the tube is a chest piece. Now there are two sides of the chest piece. One is the bell and the other is the diaphragm. For measuring the blood pressure, the diaphragm side of the chest piece is used. And once you put the stethoscope in your ears, then this stem, this part of the rubber tube is again rotatable. You are going to rotate it and tap on the diaphragm side to check that the sounds are audible through the diaphragm. When you're going to turn it to one side, the sound would be audible through the bell. And when you're going to turn it on the other side, the diaphragm side would get open. So before taking the blood pressure, you need to check that the diaphragm side is open and the sounds can be heard through the diaphragm. Now, blood pressure basically means the force which is exerted by the blood per unit area of the vessel wall. And you must have heard, that the systolic pressure is 120 millimeters of mercury, the normal value, or the diastolic value is 80 millimeters of mercury. So, what it actually means? It means that when we say that, let's say that when we say that the pressure is 50 millimeters of mercury, then this means that this pressure or this force is sufficient enough to push a column of mercury against gravity up to a level of 50 millimeters. Similarly, if I say that the blood pressure is 120 millimeters of mercury, then it means that the force is sufficient enough to push a column of mercury up till a height of 50 millimeters against the gravity. Now, blood pressure is measured as two values, systolic and diastolic. The systolic value is measured when the ventricles contract, and this is the highest value. The second value or the diastolic value is measured when the ventricles relax and they are being refilled by the blood coming from the atria. So, blood pressure is lowest during diastole and highest during the systole. The normal blood pressure of a human has a value of about 120 by 80 millimeters of mercury, meaning that the normal systolic value is 120 milliliters of mercury and the diastolic value is 80 millimeters of mercury. And this is how it's written. Okay, and the unit is millimeters of mercury. Now, there are two terms that you need to understand. One is pulse pressure, and the second is the mean arterial pressure. Pulse pressure is the difference between the maximum and the minimum pressures. And as I've already told you that the maximum value is during the systole, and this is called as the systolic pressure, and the minimum pressure is the diastolic pressure. So when you are going to subtract the diastolic pressure from the systolic pressure, then you are going to get the pulse pressure, or simply the difference between the systolic and the diastolic pressures is called as the pulse pressure. The second is the mean arterial pressure. Okay, mean means average, the average arterial pressure through the cardiac cycle. And most of the duration of the cardiac phase, the cardiac cycle, is basically spent in diastole. Therefore, the value of mean arterial pressure or the average pressure is closer to the diastolic pressure. And the formula for calculating the mean arterial pressure is diastolic pressure plus one third of the pulse pressure, which is the difference between the systolic and the diastolic pressure. So when you're going to take the pulse pressure and the one third of it, plus you're going to add the diastolic pressure to get the mean arterial pressure. Now, hypertension means that when the mean arterial pressure is greater than the upper range of the accepted normal pressure, a mean arterial pressure greater than 110 millimeters of mercury is considered to be hypertensive. The normal mean arterial pressure is around 90 millimeters of mercury, and when the mean arterial pressure is greater than 110 millimeters of mercury, then the person is considered to be hypertensive. And this level of mean arterial pressure occurs when the diastolic pressure is greater than 90 and the systolic pressure is greater than about 135 millimeters of mercury. When the systolic rises above 135 and the diastolic above 90 millimeters of mercury, then the mean arterial pressure would be greater than 110 millimeters of mercury. So coming on to the procedure of the auscultatory method is, first you're going to wash your hands with any soap or with any rub any disinfectant. You're going to make the patient sit comfortably on a stool, on a chair if he has climbed stairs, or if he has some kind of physical activity, then he needs to relax before you measure the blood pressure. Then what you're going to do, you're going to wrap the scarf around the patient's arm, and this should be positioned about 2 to 3 centimeter above the brachial artery. Okay, and how you're going to locate the brachial artery? You know that the brachial artery is present here on the elbow joint, and first of all you're going to feel the bicep tendon. Okay, you're going to ask the person to flex and extend the knee joint, and then you are going to feel the bicep tendon, and just medial to the bicep tendon lies the brachial artery. You're going to palpate it with your three fingers, and once you have palpated the pulse, you are going to use it for the determination of the blood pressure. Okay, now keeping your hands over the brachial pulse, you are going to inflate the cuff. Okay, with the help of this hand bulb, you are going to inflate the cuff until the pulse becomes impalpable. Okay, once you have located the brachial pulse, you are going to keep your fingers there, and you are going to inflate the cuff with the help of the hand bulb, and when the pulse becomes impalpable, you are going to note the pressure. Okay, or you are going to read the value present on the manometer, and this will be a rough estimate of the systolic pressure. Now, students, this is basically the palpatory method, and the palpatory method is incorporated into the auscultatory method, because the palpatory method gives you a better estimate of the systolic pressure, and this can be done also on the radial artery. Okay, you can palpate the radial artery, and you can determine the systolic pressure with the help of the palpatory method. While palpating the radial artery, the procedure is going to be the same, that you are going to inflate the cuff would be positioned above the cubital fossa, all right, but above the anterocubital fossa, and you will be palpating the radial artery, and you will be determining the systolic pressure by the same procedure, that you are going to inflate the cuff, and when the pulse becomes impalpable, then you are going to take the reading. Okay, after that, what you're going to do, that first you will release all the pressure and inflate the cuff again. Now, whatever the estimated systolic pressure was by the palpatory method, now you're going to inflate the cuff another 10 millimeters of mercury, or to be on the safe side, you're going to inflate it around 30 millimeters of mercury more, and listen through the stethoscope placed over the brachial artery. Okay, once you have determined the systolic pressure by the palpatory method, you are going to deflate the cuff, and then you are going to place the stethoscope now over the brachial artery and inflate the cuff around 30 millimeters more than the systolic pressure, which was found by the palpatory method. After that, you are going to deflate the cuff slowly. Okay, with the help of this valve, you are going to turn it counterclockwise to release the pressure and slowly deflate the cuff, listening for the Korotkoff sounds. Okay, these are the sounds that would be heard through the stethoscope when it would be placed over the brachial artery. The Korotkoff sounds are first heard as the tapping sound. Okay, and as the cuff pressure is lowered further, these sounds become louder, then they become dull, then muffled, and finally they disappear. That means that the sounds would no longer be heard. So the pressure at which the sounds are first heard, okay, the tapping sounds when they are first heard is the systolic pressure, and when the sounds disappear, meaning the reading when the sounds are no longer heard at all, would be the diastolic pressure. Once the sounds are no longer heard, deflate the cuff completely, remove it from the patient's arm, inform the patient that the procedure is finished and you have to thank him or thank her, and record the blood pressure on a sheet. Okay. Now, why the Korotkoff sounds are produced? These are caused by the turbulent flow of blood, meaning that when you have occluded the vessel by applying the pressure, by inflating the rubber cuff, you have basically occluded the vessel wall and there is no flow of blood through that artery. When you start releasing the pressure, then what happens that as soon as the pressure just gets lower to the systolic pressure, some of the blood starts to flow through the artery. Okay, initially there is no sound, but as you lower the pressure and when the pressure becomes equal or slightly less than the systolic pressure, then it means that the blood has started to flow through the vessel, but again this vessel is not completely open. Okay, it is occluded, so there is going to be turbulent flow of blood, and these Korotkoff sounds would be produced by the turbulent flow of blood. All right, and first of all, they would be tapping in nature. Then the phase 2, they will get louder. In phase 3, they will start to get dull. Phase 4, muffled, and in phase 5 they are going to finally disappear, meaning that now the whole of the vessel wall is open and there is no turbulent flow. The blood is easily flowing through the arteries and there is no sound. And this is the phase 5, which is the estimated diastolic pressure. Okay, now auscultatory gap is a period uh, in which there are diminished or absent Korotkoff sounds. All right, this auscultatory gap is present in some hypertensive patients, and you need to be very careful about this auscultatory gap, because this is a gap in which the Korotkoff sounds, they can get absent or they can be diminished. So if there is improper interpretation of this gap, then it can lead to underestimation of systolic blood pressure or overestimation of diastolic blood pressure. So you need to be careful with the auscultatory gap. Now, if you look here, that there is an auscultatory gap between from ranging from 170 millimeters of mercury of the blood pressure up till around 150 millimeters of mercury. Okay, so If you raise the pressure, let's say around 160 millimeters of mercury, and basically the systolic pressure in this patient was actually 200. Okay, the diastolic was around 100 millimeters of mercury, but an auscultatory gap was present from 170 to 150 millimeters of mercury. All right, and this is why this also shows the importance of the determination of the systolic blood pressure via the palpatory method, because when you determine the systolic blood pressure with the help of the palpatory method, this helps in preventing or avoiding the auscultatory gap. So you can see here that if the blood pressure or the pressure in the cuff is inflated to, let's say, around 170 millimeters of mercury, all right, and then the pressure is slowly released, then at 150 the first Korotkoff sound would be heard. All right, so this will lead to underestimation of the systolic blood pressure, meaning that actually the systolic blood pressure was 200 millimeters of mercury, but because of the missing of the auscultatory gap, the the first hearing of the Korotkoff sound would be at 150, and the systolic blood pressure would be mentioned as 150 millimeters of mercury. All right, and secondly, how the overestimation of diastolic blood pressure can be there. But let's say that initially it was raised to 200, all right, and they started deflating. Okay, and then at 170 there would be no longer Korotkoff hearing of the Korotkoff sounds. So the diastolic pressure can also be labeled as 170 millimeters of mercury, but actually diastolic pressure in this patient was around 100 millimeters of mercury. So you see that this auscultatory gap needs to be avoided, needs to be basically kept in mind. And how to avoid missing this gap, the brachial or the radial artery should be palpated while the pressure is increased, so that the approximate or the estimated systolic pressure can be find out, and then you are going to raise the pressure above 30 millimeters. Above that, that would be helpful in missing avoiding missing the auscultatory gap. So the observation is how this is how you write the observation chart, that the systolic and the diastolic reading in the left arm and the right arm separately. Blood pressure in the left arm is, whatever the reading is in unit of millimeters of mercury, and similarly in the right arm